I put this presentation together a number of years ago, um, about 9 years ago at this point, and have made some minor edits here and there over time. Basically, in reading about crucifixion, started to realize that this hypothesis that um, it was an asphyxial death really seemed to lack substantiation. And I wanted to really kind of dive into this a bit and see what I could find, and maybe, not only get myself an education, but get others educated on the topic as well. And so we're going to talk about crucifixion. And there are graphic images in this, and they start immediately, including modern photographs of executed individuals. If that sort of thing upsets you, then do not watch the rest of this presentation. If you've got a stomach for that, then you may find this educational. And so, why talk about crucifixion? And when I first made this presentation in 2015 ish, ISIS was big in the news at that time, and Google searches easily revealed incidents of people being crucified or executed and their bodies put on display in crucifixion type poses. And just doing an English language internet search on that, you get a lot of connection to ISIS with these, but I can't read these languages and can't substantiate whether or not these are indeed victims from ISIS. But it's still happening that people are conscious of crucifixion and at least posing bodies in that situation. I suspect a number of these people probably were shot first. But okay, that's way over there, and I'm in America, so, why talk about crucifixion? Again, going on at that time, ISIS being in the news, there was a fairly robust amount of information about people, being recruited to ISIS from the United States over there. And so, if these are indeed ISIS victims that we see there, are they crucifying people? And if we have U.S. citizens who are being recruited to it, then is crucifixion coming to a neighborhood near you? And so that was the concern at the time. And that concern may be not quite as great at this moment, but it's still, a possibility that it could happen as an exercise in domestic terrorism, that a crucifixion could occur. And one of the most outspoken people for ISIS was in Dearborn, Michigan, and I'm in Michigan. I was in Ohio at the time. So let's talk about crucifixion. Obviously, the historic crucifixions in the context of the Roman Empire, and most specifically the single example of the crucifixion of Jesus, are the most famous examples and what consumes the lion's share of the conversation. Let's find out what's in the literature. Well, it turns out actually there are a number of articles in the medical literature on crucifixion. It's quite shocking, actually, and you can find a number of them. That was 2003. Here's a 2006 article. Here's 2012, a 2002 article from, a hypothetical emergency care response if you were to have a crucifixion victim. And indeed, just the keyword search in PubMed will give you loads of articles, people talking about crucifixion in the medical literature. It's really interesting. People find this fascinating. But we need to understand crucifixion, I think, a little better than what we would get piecemealing it together from a lot of articles and hypotheticals. So what are the things you have to consider? Well, the cross itself, the method of crucifying the person to that cross, and anatomy and physiology. And so let's talk about the cross. There are different possible forms, right, or shapes that they could take, and therefore methods also for securing people to them. It's interesting in a lot of these articles that you can find, for some reason, people can't really seem to resist making their illustrations kind of the Western archetype of Jesus in like the Roman Catholic artwork, and so we get these long-haired individuals that imply Jesus, and so we're going to see that again and again here. But here we have, that cross beam that is part of the cross being carried. And we see this Edwards article that was published, interestingly enough, in JAMA in 1986. This article seems to have done a lot to solidify in people's minds the nature of crucifixion. And unfortunately, I think that probably is a bad thing. And so we see here Jesus in an archetypal, artistic form, carrying the patibulum, that's the crossbeam that goes onto the stipes, the vertical component of the cross. And so we see it affixed to his arms, being tied there. But there are variations in crosses. So that's a T-shaped cross we just saw, which would be the crux sublimus. And then there's the humilis, a low T. It can be a crux simplex, which is just a post. Or it could actually be a legitimate tree, and then a number of others. The decusata would be an X-shaped. If you think about the hero in Roman Catholicism, you see that symbol. It looks like an X and then what looks like a P, but it's the Greek letter chi and the Greek letter rho superimposed on each other. And a lot of what we think of for crucifixion comes out of this book from Justin Lipsius. It was originally published in the 1590s. I sold a 1597 not too long ago, and this 1606 copy I just sold as well. But you're going to see some artistic thinking here. On the right, we have a crux simplex, right? It's just a post, and in this case, so they're nailed to it, and in this case, we have the added benefit of conflagration. And then over here in our T-shaped cross, a little more traditional thinking, still nailed to it. Now we've got lions and maybe bears, I'm not sure, some sort of beasts chewing on this person. And so a couple different variations of the cross there. On the right, again, we have the decusata, the X-shaped cross. And over here, a more imaginative version of what might qualify as crucifixion. And so this person being impaled on a pike, sort of Vlad the Impaler-esque. And then we see other versions of the cross. In this illustration here, you can kind of see this weird horn coming off from here and right here. Those are branches. So this is, if you look down here, these are tree trunks, not actual posts inserted into the ground. This is a tree trunk, and it's been trimmed of its branches with a portion left to be able to put the patibulum across it. And so you've got these different shapes of cross. This one's a Y shape. And then over here, being crucified upside down on a T-shaped cross. And then this interesting patibulum wedged here in place with these beams going down so that the person is splayed out in an X shape, being nailed at 4 points. And this type of position for crucifixion is actually photographically documented, having happened. This, I believe, was circa World War II-ish. And so this individual appears to have been crucified and is tied in place, it looks like. It does not appear to be nailed. Well, that's in the literature, but artistically so. We can look at other ancient evidence, though, to see what we have for ancient crucifixion methods. And one of them is this interesting phenomenon called the staurogram. And I got to see a bunch of examples of this actually at the University of Michigan's papyrology department a couple of years ago, which was a great experience. And they had a particular papyrus that was quite heavily laden with staurograms. And so the staurogram is the word cross, stauros, with the tau and the rho superimposed upon each other, stauron. And so you get the appearance of a little guy on a cross right in the middle of the words, or in the word. And so this is important, actually, because this is iconography, right? You would not want to symbolize the cross with something that people wouldn't recognize as crucifixion, right? If ancient crucifixion was all, say, the decussata with the X-shaped cross, or all a crucimplex where it's just a post, this never would have been imagined or used. Or if the person that did try to do the staurogram to represent crucifixion, if they went with this shape, their readers would not have recognized it. So this tells us that a sufficient number of ancient crucifixions must have been in this configuration that this would ever have any meaning, and that people would think to write it that way and recognize it. So there must have been enough crucifixions that were this T-shaped cross that the staurogram would even come into being. And okay, so that's really what I said. This is just written out what we were just talking about, looking at the image there on the papyrus. So the method of crucifixion. So different shapes of crosses may or may not have been used, and certainly the T shape must have been used because of the staurogram. But how do you affix somebody to the cross? Well, what about archaeological evidence, right? There were gajillions of crucifixions going on in the Roman Empire, right? It must be pretty robust archaeological evidence. Actually, it's not. There's very, very little evidence for crucifixion, and only recently has it actually trebled. For a long time, we had only one bone to work with, and we were assuming that that person was, in fact, crucified. And so we have Yehohanan, who was crucified probably in the 1st century. And it was found in an ossuary in 1968, the skeletal remains, and were published in 1970, and then a reconsideration of further study of these remains in 1985. And so here is the inscribed ossuary, and here is a single bone from the foot with a nail still through it. And we infer that this nail means they were crucified. Now, could a person have been tortured in some other way with a nail through the foot without necessarily having been crucified? Yeah, that's a possibility. But working with what we've got and what we know, the theory is this person was crucified. And so here's a closer, cleaned up image of that nail through one of the bones of the feet. And so the initial thought was that based on that nail through that bone, how would the person be situated on the cross? And so it was thought maybe one nail through both calcanei in the feet, with a person having their legs kind of splayed out like that, or potentially bent over to one side. This was indeed reconsidered later on, where this was less the favored theory. And then we have over here in the 80s this hypothesis of a nail through each foot so that they are affixed to the lateral aspects, one on each side of the vertical post of the cross. And then you see this person, their arms are tied in place to the patibulum. Keep in mind, this is all based solely on a single bone, right? We got all of this off from one bone. This is the favored theory. So it's kind of a reach. I'm a forensic pathologist. I don't like drawing conclusions that large off from a single point of evidence, but archaeologists don't seem to be bothered by that, interestingly enough. And so we see the modern equivalent here. This person was probably executed and then hung up on this cross, but we see this, right, with tied over the board there and affixed to a vertical post. So this is going on in some capacity. Well, lo and behold, 2007 excavated remains in Italy found skeletal remains with holes through them that seem to correspond to our understanding of crucifixion. So we may indeed, as of fairly recently, have a second point of biological evidence for crucifixion. And this does harmonize with what we see in the remains from 1968. And then lo and behold, 2021 in Britain, which was Roman occupied at one point, we have another bone recently found, very recently found, with a nail through it. And so we've tripled our evidence for crucifixion based on biological remains. It's still not really all that compelling, though, to know what common methods were in place. What about nails that passed only through soft tissue? We would have no biological evidence to work with because only the bones remain. So it may just be that these are so rare because indeed it was rare for the nail to pass through bone. It's one possibility. And so we see that the whole skeletal remains laid out from that most recent find. Well, crucifixion, I have no doubt in my mind, probably was variant based on the extent of imagination of those doing it. It's been said that the Romans had execution and torture down to a science, but my intuition is that throughout the Roman Empire, a fair bit of creativity happened at the hands of those who were doing this. I mean, how much oversight really was there? Let's be honest with ourselves. So artists have a fair bit of imagination, and so too, I imagine those doing the crucifixions did too. And so we often think of the nail passing in through the palm. Here we see the arms turned the other way, so the hands are kind of gripping the wood, and the nails passing from the extensor surfaces of the wrists into them. And then here we have in a Barry Moser engraving this kind of sigmoidal cross with the person affixed to that and feet partially tied. And we see here in the background a configuration similar to the archaeological hypothesis from 1970. And we see a nail through this foot that would be passing from the extensor surface to the plantar surface rather than going transversely through the calcaneus like the biological evidence we have. And indeed, further imagination, Dante's Inferno, Caiaphas is crucified to the ground so that people walk on him. So is it possible that somewhere in the course of history people really were crucified to the ground rather than vertically? I imagine that probably happened at some point. People are creative. But that's art. What about the anatomy of all of this? Well, there have been limited cadaver studies, and putting the nail through the palm suggests that it will fail. The weight of the body will tear through based on some cadaver evidence, and therefore it's probably more likely that the nail was not put through the palm itself, but put through the wrist. However, what if the person was also tied in place as well as nailed, and so some of that weight may be supported? Here's where we think of in cross sections of hands from Rohan's Anatomy Atlas. If you're putting a nail right between the long bones within your hands, it might pass through the fleshy areas there, or further back into the wrists, it has to make it between some more irregular bones, but certainly could be done. And you'll pass through certain tendons on the way potentially, which could cause particular patterned flexion type positions of the hand resultant from this. And so we see Edwards' article here, and he has the nail going through the wrist, and you see this kind of gripping position of the hand resultant from the nail pushing through those tendons. And we have cadaver evidence, and we see this extension of the index finger here with curling of these fingers after probing through the resultant nail injury in this. And so indeed it does seem anatomically and physiologically that a real crucified person would be having this happen. Barbet prefers this destos space as opposed to the Z area as the hypothesis for where that nail would have gone, and it would separate the carpal bones away from one another. Again, we don't actually have evidence for that, but that's what he liked. And so here's radiographic evidence of the positioning of the carpal bones after you've pushed a nail through in between them. And this is probably what a Roman nail looked like. And so, if we reproduce a Roman nail using a cadaver arm and pushing it through as these researchers did in 2005, nailing it to a block of wood at the different spaces. So here we see more near the Z area and then further back towards Destos space, and then get 3D reconstruction, computed tomography of these. And here's the distal placement, and here is the more middle placement, and you see the resultant displacement of the carpal bones. And here's the proximal placement, and so you have radius and ulna with their interface with the carpal bones here. And so you've got options. Again, we don't have biological evidence for this from historic crucifixion. And then after imaging, subsequent dissection, seeing this, Roman style nail passing straight through a tendon. And so that's the hand. What about the foot? It's most commonly thought, I think, in the popular mind that the nail passed between the metatarsals through the soft tissues such that the tarsals were resting on it. We saw this in some of the art examples, but the archaeological evidence suggests that at least 3 instances were hammered straight through bone laterally. And so similar cross-section to what we saw before in Rowan's atlas, but now we're looking at a cross-section of the foot rather than the hand, and so the nail would have to pass down between 2 of these metacarpal bones, metatarsal bones. And Edwards illustrated this exactly and shows the point where the nail would be, and therefore your carpal bones would be resting down on this, and so the feet would be nailed essentially with a single nail and overlapping feet into the wood. That's the theory. What other injuries? Well, we should mention the side, right? Jesus was pierced in the side. In the gospel narratives that talk about the crucifixion, we have the side, and the word there is pleuron, and the pleura actually lines the inside of the chest wall all the way around on the inside. And so when you're pierced through the side, where does that go? Does it go up into the chest and through a lung into the heart, or can the side enter actually over into your stomach and spleen, or on the right side through your liver? So what does side mean? Nobody really knows, but it's worth considering if you're talking about the crucifixion of Christ, is to take into consideration those anatomic factors. And so Edwards illustrated it thusly and took the side rather obliquely and to the front and into the heart. There's a theory that the explanation for blood and water flowing from Christ being pierced through the side was actually not just obviously blood from the injury, but an effusion, pleural effusion or pericardial effusion, which is a watery liquid that builds up sometimes in those spaces in diseased or traumatic cases. And so that was leaking out, and hence blood and water. So these people offer a pathophysiologic explanation for it rather than miraculous. Who's to say? None of us know. So additional trauma also may have occurred. Here we see in Barry Moser's illustration, this is the Apostle Paul getting flogged, and certainly Jesus was flogged as well. And we have Edwards' illustration of what a Roman flogging looked like, basically arguing that it was a real science and that you would get these, symmetric, oblique injuries from the flail or whatever's being used, flagrum, I guess. So they had it down to a science, supposedly. Who knows? It reminds me personally of the chop wounds seen in boat motor injuries that we see in forensic pathology occasionally, where there's a periodicity to it. They're very evenly spaced. In the Passion of the Christ film, I was actually really impressed. They use these flexible rods. I'm sure they have a name, but I don't know what it is. And in whipping Christ, played by Jim Caviezel, you get these parallel red linear marks, right? There's an area of pallor with 2 red linear marks on either side, separated by the central pallor. This kind of railroad or tram track pattern. That is strikingly realistic. I was really impressed with that part of the film. Because that's exactly what we see in forensics. Classic are baseball bat injuries, but pipes will do the same thing, where where the bat strikes the body, it squeezes the capillary shut, and that blood gets shunted over or pushed over rapidly to either side of the point of impact so fast that the pressure is too high for the vessels to accommodate and they rupture on either side of the object. And so you get these parallel marks with a central pallor. And so I was very impressed how well they did that in that movie. So one other form of injury, this blunt force trauma that may precede the crucifixion itself. And blunt force injuries like that can cause fat embolism, where you liquefy the fat under the skin and it can get into the now broken blood vessels, and therefore the fat travels. I see it commonly in the lungs from people who've had CPR because they get rib fractures, and so fat and marrow emboli travel to the lungs. They can go to the brain in some instances. Here we see it in a glomerulus, which is part of the kidney. So these can be lethal in and of themselves. So, physiology, the mechanism of death. How does crucifixion actually kill a person? Well, the leading hypothesis is asphyxia. And so let's talk about respiration. 100% of your blood passes through your lungs. And as metabolic demands increase and circulation speeds up and blood volume is lost from your injuries, the metabolic demands for oxygen increase. And CO2 builds up, and therefore respiration must also increase. You're going to be breathing faster and have a drive for oxygen. This can produce an ineffective hyperventilation where you're breathing faster, but you're not exchanging CO2 for O2 at the level that you need to, commensurate with your effort. And therefore, diaphragmatic and intercostal muscle fatigue could complicate this also from the hyperventilation. And so you have a respiratory fatigue where you're not getting enough oxygen. You have a buildup of CO2 and your breathing apparatus, your muscles just can't handle it anymore. Well, historically, like I said, asphyxia has been the favored hypothesis. This seems to stem from Barbet's work in the 30s. It is thought that tension forces in the arms to the thorax when you're hanging on the cross cause the chest to expand passively. You're just pulling your chest upward and outward through tension through the arms, and that puts you into passive inhalation. When you inhale, the chest expands. And so therefore you have to actively exhale on the cross by pulling yourself up to overcome those tension forces, because you sag down and that pulls your chest up and out, and therefore you're inhaling passively and you have to exhale actively. It's the opposite of breathing for a normal person sitting in a chair, right? You normally exhale passively and inhale actively. And so then along with this, the theory about breaking the legs, if you break their legs, they can no longer raise themselves up to exhale, and so they asphyxiate. There have been limited studies putting people on crosses and taking like spirometry and pulse ox and all that. It's been mixed results. I think this positional asphyxia thing is at best a minor factor. And so ribs have two primary types of motions: the pump handle motion, where your breastbone kind of rocks upward as you inhale, and the bucket handle motion, where the ribs kind of swing out and upward when you inhale. So that's the theory about your arms. Your muscles in your arms connect to your chest, and so if you're hanging by your arms, they're going to pull on those ribs and pull them upward into the inhaled position. And so Edwards illustrated this here, where the person hanging down, their chest is pulled into the passive inhalation position, and so they have to physically pull themselves upward on the cross to be able to exhale, and then they sag back down, and then they pull themselves back up, sag down, pull up, and so it's a rhythmic motion of trying to breathe until they can't keep it up anymore and they asphyxiate. Here's the thing about this. There's zero evidence for this. None whatsoever. It's just a hypothesis. It was reasoned anatomically and physiologically that this would happen. There is no evidence of this ever actually occurring. We can nail cadavers to crosses and see how they hang, and do we see this significant tension force through them? No, we don't. This is like the ultimate white coat phenomenon where volunteers will just do whatever a person in a white coat tells them to do. And so here's a person, being crucified. They're like strapped into this cross in Pierre Barbet's living room or wherever he is. I guess it's probably his office, and hooked up to EKGs, and there's probably a pulse oximeter on there somewhere, and a sphygmomanometer and all that jazz. And so we don't see this rhythmic motion, even though Barbet advanced this hypothesis and Edwards sealed it in everybody's minds forever, and regrettably so, with his 1986 JAMA article. Like I said, spirometry has been done. D.A. Ball published on this to see what would happen. And again, the results were mixed, and it's not really a good there's not really a good argument to be made for asphyxia. Spirometry changes were seen, and respiratory pattern changes were seen, but and in some cases somewhat drastically so, the breathing pattern. But was the person just uncomfortable or what? That rhythmic motion is not documented in the medical evidence. Now, could there be other forms of respiratory failure and asphyxia for this person with their head dropped to their chin? Would that close their glottis, and therefore they can't draw air in past their mouth down to their lungs? That's a possibility. Again, this person probably was actually shot before putting on there anyway. So we talked about breaking the legs. Would that accomplish, the accelerated asphyxial death? And that makes sense if indeed that rhythmic motion was necessary, but we have no evidence for that. Breaking your legs would potentially contribute to fat and marrow emboli, as I mentioned before, that I see in CPR and with beatings that you can get them. And so maybe that would also accelerate a person's death. So maybe that's why it's recorded in the gospel for breaking their legs to speed up their death. Oh yeah, and so Bayard published on this as well, and they, based on respiratory studies for people where test subjects hung on a cross, there was significant tidal volume loss after mere minutes, and yet Bayard still asserts it took days to die. So if these respiratory changes were happening in minutes, well, is it really what's contributing to their death if it took days to die of it? This assumes the placement of the nails. It assumes that the position of the legs were bent at 45 degrees, and it may be similar to a so-called reverse hanging mechanism. We don't know that this is how people were crucified. And so the reverse hanging is a strappado also, where people are tortured and they're hung up by their arms and wrists behind their back. So that would like hyperextend backwards and hang you up by that. And obviously that would be just terrible pain. And it can cause rhabdomyolysis or rhabdomyolysis and be fatal. And so maybe the person on the cross also might succumb to rhabdomyolysis. But let's go back to breaking the legs. Okay, if this is the favored hypothesis here from the archaeological evidence, which is virtually none, and so this is imaginative, but if that's the case, what would breaking this person's legs do? This person is fixed such that they can't sag down because their arms are over the patibulum, and they can't raise up because both ankles are fixed in a single place with their back against the stipes. So this person would have no up or down motion at all. It'd be impossible. So breaking the legs couldn't possibly account for interrupting the rhythmic motion to accelerate an asphyxial death. It just doesn't make any sense. So some other theories on what might be involved. What about right heart failure? So due to pulmonary congestion and edema with pleural effusion resulting from the trauma that we talked about, we may get right heart failure. In systemic circulation, your capacitance vessels dilate. Those are the vessels that are the veins right after your capillaries. They dilate in hypoxic tissue to promote blood flow to that area. So a portion of your body needs oxygen. Those vessels dilate to get more blood to it so it gets oxygen. The lungs are opposite. In hypoxic areas, the vessels constrict to shunt blood away from that part of the lung to send it to the parts of the lung that are getting oxygen, right? Because the whole point of the lung is to oxygenate. And so if a part of your lung isn't getting oxygen anyway, your body redirects blood away from that part of the lung to other areas so that it does get oxygen into the blood. This, combined with pulmonary congestion and atelectasis, could cause an acute pulmonary hypertension from all these vessels constricting. And now your right heart has to work harder, and you have increased right heart afterload. And so you may go into acute right heart failure because it's the right heart that's pumping blood to the lungs. Embolic deaths are another possibility. So from third spacing all your fluid, you're getting dehydrated and you're bleeding. And so you're losing water from your blood into the tissues or out of your body entirely. You're raising the hematocrit, potentially increasing viscosity and promoting thrombosis, as well as just in the context of the injuries themselves. From being static on the cross and unable to move because that rhythmic motion probably isn't happening, you're probably static, and so you may be forming deep vein thromboses, and maybe all the more so if your legs are broken. And then those could embolize. Along with the fat and marrow embolism we talked about, you could have thromboembolism to go to the lungs, and that could explain death. Talked about right heart failure. What about left heart failure? Third spacing of the fluids, as we discussed, may occur as edema develops around your injuries, and so to maintain perfusion pressure as your circulatory volume decreases, vasoconstriction will occur, and now left heart afterload increases. The left side of your heart that's pumping blood to your whole body apart from your lungs is working against greater resistance with less and less blood to it, and so you could get left heart failure. Don't know this for sure. These are all theories. Exsanguination, the favored sites for nail placement would not likely cause severe bleeding, though there are arteries in the palm. If they did go through the palm, that could be hit, and those might bleed quite a bit. The additional trauma preceding crucifixion might cause a whole lot of bleeding, though. It's not a factor in crucifixions that didn't incorporate that trauma, of course, but it could. And if you weren't nailed to the cross at all, but you use ligatures, then exsanguination probably is not a component to be considered. And so we see here this modern example of a person placed into a crucifixion type pose. Again, they may very well have been shot ahead of time, but this person is affixed just by being tied. Dehydration, okay. Person's been traumatized, they're bleeding, they're out exposed to the hot sun after physical exertion. They may just die of dehydration. That is one possibility to consider, instead of this asphyxial death. So we've got right heart failure, left heart failure, dehydration, embolic events, exsanguination, all mechanisms to consider instead of the favored asphyxia, for which we have no evidence. So, as I said, positional asphyxia seems unlikely. I think these other things are more compelling. If you were certifying this on a death certificate, what would you write? Well, their cause of death could just be crucifixion, if that would capture it. Or you could say complications of crucifixion, or blunt and sharp force injuries, depending on how the exact scenario went. But what we see here is that asphyxia probably is not part of the equation. I hear pastors and theologians working off from this older literature, and particularly what came out of Barbet and Edwards publications, always saying Jesus asphyxiated on the cross. I think they really need to stop preaching that. It's outside the text, and it is outside current medical and scientific evidence. There's no compelling reason to think that somebody asphyxiates on the cross. Manner of death would be homicide, of course, or is it? So I gave you all these examples of extrajudicial execution by crucifixion, but actually crucifixion is still practiced in some parts of the world, particularly the Philippines and some parts of Latin America, by Roman Catholics on a voluntary basis. This happens annually on Good Friday, where people volunteer to have themselves nailed to a cross. And if they died up there, is it homicide? Well, the person doing the nailing put them there, so maybe it's homicide, but they were volunteers, so maybe it's suicide. What about accident or indeterminate for manner of death? I'll let you decide. But this does go on, and you can find videos of it. I think this person maybe wasn't truly nailed. This is in Mexico. I think this is painted on there and that this is faked. He's got a microphone to probably recite lines, unless he's supposed to be telling the crowd what it is he's feeling. I'm not sure. But this happens annually for this big event for the reenactment of the crucifixion of Christ. And so I don't think this is real. This one, however, in the Philippines apparently is real. And you see this position of the hands from passing the nail through the center of the palm seems to be a genuine physiologic result from truly being nailed to a board. And this particular individual has been crucified apparently 35 times with nails through the hands. Probably by now it's going through scar tissue and it doesn't hurt as bad, I should hope. But this is theologically interesting because the the doctrine and theology that is expressed and developed around the crucifixion of Christ is that of atonement and sacrifice and penal substitution. The point is that Jesus was sacrificed in our stead on our behalf, so we do not pay the price for our sins. He paid it. And so these people who want to suffer as Christ suffered actually are doing not an act of devotion, but are denying the crucifixion of Christ. So if you're inspired by this as an act of devotion, I would ask you to please reconsider and don't let someone nail you to a cross. This is actually a denial of what Jesus did, because you're saying, no, Jesus didn't pay the penalty for me. I'm going to have myself tortured. So please don't do that. It's a health risk, and it's spiritually misplaced, if I may be so bold to say so. So it's still practiced, and what do we not see? The rhythmic motion of people attempting to breathe, raising themselves up and sagging down from their reversed inhalation-exhalation mechanism. And so that strongly argues against the hypothesis that is so entrenched in people's minds. There's no reports of that happening in these crucified people. We don't see it happening, so I think that hypothesis is defunct and can be dismissed. And so there's a lot of references you can look at for all sorts of jazz pertaining to crucifixion now in antiquity, in art, in literature, and the biblical crucifixion of Christ. But we'll leave it there. And so I encourage you to ditch the asphyxia hypothesis. And thank you for your attention.